Cucumbers are celebrated for their numerous health benefits, but did you know that combining cucumbers with certain medications could lead to dangerous health consequences? In this article, we'll explore some specific medications that might have adverse interactions with cucumbers and provide insights on how to safely incorporate this food into your diet. Blood thinners. A study published in the Journal of Clinical Pharmacology found that foods high in vitamin K, such as cucumbers, can interfere with the effect of blood thinners like warfarin. Vitamin K plays a crucial role in blood clotting, which can counteract the intended effects of blood thinners. If you're on blood thinners, be mindful of your cucumber intake, monitor your vitamin K levels, and consult your healthcare provider to adjust your diet accordingly. Beta blockers. Research in the American Journal of Hypertension indicates that cucumbers, due to their high potassium content, can affect potassium levels in the blood, which is critical for patients on beta blockers. Excess potassium can lead to hyperkalemia, a condition that affects heart function. For those on beta blockers, it's essential to balance your potassium intake. Speak with your healthcare provider about how much cucumber is safe for you. Diuretics. A study in the Journal of the American Geriatric Society found that cucumbers can have a diuretic effect, potentially compounding the effects of diuretic medications. This can lead to dehydration and electrolyte imbalances. If you're on diuretics, be cautious with cucumbers. Ensure you stay hydrated and maintain proper electrolyte levels. ACE inhibitors. Research in the British Journal of Clinical Pharmacology highlights that cucumbers' potassium content can interfere with ACE inhibitors, leading to elevated potassium levels and subsequent muscle cramps or fatigue. For those taking ACE inhibitors, moderate your cucumber intake and monitor your potassium levels regularly. Statins. A study in pharmacotherapy revealed that certain foods, including cucumbers, can interfere with the metabolism of statins, leading to muscle pain and weakness as common side effects. If you're on statins, be mindful of your cucumber intake to avoid exacerbating muscle-related side effects. Calcium channel blockers. Research in the American Journal of Cardiology suggests that cucumbers can exacerbate the side effects of calcium channel blockers, including swelling and dizziness, due to their impact on electrolyte balance. For those on calcium channel blockers, it's crucial to monitor your diet and cucumber intake to prevent unwanted side effects. Antibiotics. A study published in Antimicrobial Agents and Chemotherapy found that cucumbers can interfere with the absorption of certain antibiotics, leading to reduced effectiveness and potential digestive disturbances. If you're on antibiotics, limit your cucumber intake to ensure your medication works effectively. Antifungals. Research in the Journal of Antimicrobial Chemotherapy indicates that certain foods, including cucumbers, can affect the absorption and effectiveness of antifungal medications. For those on antifungals, consider reducing cucumber intake to enhance medication efficacy. Antidepressants. A study in the Journal of Clinical Psychopharmacology found that cucumbers, which can affect serotonin levels, might interfere with the action of certain antidepressants, leading to increased anxiety. If you're on antidepressants, monitor your cucumber intake and discuss any dietary concerns with your healthcare provider. Immunosuppressants. Research in transplantation proceedings suggests that cucumbers can interfere with the absorption and effectiveness of immunosuppressants, leading to an increased risk of infections. For those on immunosuppressants, consider limiting cucumber intake to enhance medication effectiveness and reduce infection risk. Thyroid medications. A study in the Journal of Thyroid Research found that certain foods, including cucumbers, can interfere with the absorption of thyroid medications, leading to reduced effectiveness. If you're on thyroid medication, be mindful of your cucumber intake to ensure your medication works effectively. Anticoagulants. Research in the Journal of Thrombosis and Hemostasis suggests that cucumbers, which can affect blood clotting, might interfere with the action of anticoagulants, leading to an increased bleeding risk. For those on anticoagulants, monitor your cucumber intake and consult your healthcare provider regularly. Anti-diabetic medications. A study in diabetes care found that cucumbers can affect blood sugar levels, potentially interfering with the effectiveness of anti-diabetic medications. If you're on anti-diabetic medications, be cautious with cucumbers and monitor your blood sugar levels regularly. Anti-seizure medications. Research in epilepsy indicates that cucumbers can interfere with the absorption and effectiveness of certain anti-seizure medications, leading to an increased seizure risk. For those on anti-seizure medications, limit your cucumber intake and discuss dietary concerns with your healthcare provider. Chemotherapy drugs. A study in cancer chemotherapy and pharmacology found that certain foods, including cucumbers, can interfere with the absorption and effectiveness of chemotherapy drugs, leading to increased side effects. If you're undergoing chemotherapy, be cautious with cucumbers to avoid exacerbating side effects. Antipsychotic medications. Research in the Journal of Clinical Psychiatry indicates that cucumbers can affect serotonin levels, potentially interfering with the action of antipsychotic medications. For those on antipsychotic medications, monitor your cucumber intake and discuss any dietary concerns with your healthcare provider. Antacids. A study in gastroenterology found that certain foods, including cucumbers, can affect the effectiveness of antacids, leading to persistent acid reflux symptoms. If you're on antacids, be mindful of your cucumber intake to ensure your medication works effectively. Hormone replacement therapy, or HRT. Research in menopause suggests that cucumbers can interfere with the absorption and effectiveness of HRT, leading to increased side effects. For those on hormone replacement therapy, consider limiting cucumber intake to reduce side effects. Antihistamines. Research in the Journal of Allergy and Clinical Immunology indicates that cucumbers can enhance the sedative effects of antihistamines, leading to increased drowsiness and lethargy. For those on antihistamines, be cautious with cucumber consumption to avoid exacerbating sedative effects and impacting daily activities. NSAIDs. A study in gastroenterology found that cucumbers, which can be slightly acidic, might exacerbate gastrointestinal side effects in patients taking NSAIDs, leading to discomfort and irritation. If you're on NSAIDs, moderate your cucumber intake to minimize potential gastrointestinal side effects and maintain comfort. Tips for safely consuming cucumbers. While cucumbers can interfere with various medications, there are ways to safely include them in your diet. Consult your healthcare provider. Always discuss your diet with your healthcare provider, especially if you're on medication. Moderation. Limit your cucumber intake to avoid potential interactions. Monitor symptoms. Keep an eye on any unusual symptoms and report them to your healthcare provider. Timing. Separate cucumber consumption from your medication intake by a few hours. Hydration. Ensure you stay well hydrated, especially if you're on diuretics or other medications that affect hydration. Balanced diet. Maintain a balanced diet to avoid excessive intake of any single nutrient. Potassium levels. Monitor your potassium levels if you're on medications that affect potassium balance. Blood sugar levels. Keep track of your blood sugar levels if you're on anti-diabetic medication. Electrolyte balance. Ensure proper electrolyte balance, particularly if you're on medications that affect electrolytes. Professional guidance. Seek guidance from a registered dietitian or nutritionist to tailor your diet to your specific needs and medications. While cucumbers are a healthy addition to most diets, they can interfere with various medications, particularly for those over 60. If you're on any of the medications mentioned, it's crucial to monitor your cucumber intake and consult your healthcare provider. Making informed dietary choices can help you enjoy the benefits of cucumbers while avoiding potential side effects or health risks. Always consult with a registered dietitian or nutritionist before making significant changes to your diet. If you found this video helpful, share and subscribe for an update on other health topics.